Describe the photograph.
This is a clinical photograph of right hand and wrist. Demonstrate a swelling of the dorsal-radial aspect of the wrist. This is typical site for dorsal wrist ganglion. Differential diagnoses include pigmented villonodular synovitis, foreign body carcinoma, fibroma of tendon sheath.
Give a definition of this condition.
Ganglion is a mucin-filled cyst lined by compressed collagen and few cells, no epithelial or synovial lining. It contains mucin, which is mixture of glucosamine, albumin, globulin, and hyaluronic acid, the most common hand mass.
What are the common locations of this condition?
First, dorsal aspect 70%, or some scapholunate articulation. Second, volar 20% originated from radiocarpal or STT joint. Then volar retinacular originated from herniated tendon sheath. And dorsal DIB joint, mucus cyst associated with Heberdean nodes.
How would you confirm the diagnosis?
By taking history, specifically asking about any fluctuation in size. Clinically, this is a smooth swelling attached to deep structure but not to the skin and are commonly translucent to light illumination. Radiograph of a ganglion will be normal, although T2 weighted MRI axial image of the wrist will show an signal where the cyst is located.
How would you manage this condition?
Consult the patient. This is a benign condition. As long as there is no history of increasing in size or pain, this may be the only treatment necessary. If there is pain affecting function, especially with forced wrist extension, then surgical excision may be offered. The recurrence rate is 5%, require adequate exposure to identify organ and allow resection of stalk and abortion of adjacent capsule at dorsal DIB joint. Must resect underlying osteophyte. Aspiration, higher recurrence rate, 50% than surgical resection, but minimal risk, so reasonable to attempt.